All righty. I think we've got a critical mass, so we'll start. Hi, everybody. I'm Liz Voiles from the Keep America Safe Coalition. For those of you joining us for the first time, this is a coalition that was formed earlier this year in response to proposed cuts to the CDC Center for Injury Prevention and Control. And it's organized by the Safe States Alliance. Our mission is to educate and inform policymakers about the Injury Center's unique and critical role in preventing injury, suicide, and overdose. Today, you're going to hear from two experts who are going to update you on the latest. Sharon Gilmartin, Executive Director of Safe States Alliance, and Paul Bonta, who is Director of Government Relations at Safe States. Before we get to our speakers, I will cover a little bit of housekeeping. So today's meeting is being recorded, and it will be shared with everyone who registered in the coming days. We're going to have some time for questions after some opening remarks, and we're going to take those questions in the Q&A box at the bottom of your screen. Just make sure that you use the Q&A box, not the chat, please, so that we can track the questions easily. If you have any technical difficulties, please just raise your hand and one of us will reach out to you to resolve it. Okay, now thanks again for joining. We're gonna hear from Sharon Gilmartin now, the Executive Director of Safe States.
Hi, everyone. Thanks again for being here today, and really thank you for your stamina. There has been a lot of dedication to preserving and protecting the Injury Center. I know it's been high volume. It's hard work. We've been at this for a while now. So while we are here to talk about some time-sensitive updates, I do want to kick us off with a few wins, a few victories to show that with all of this work and all of this effort that you're putting in is not for naught. It is making a difference. So hopefully you've heard by now, but win number one is that 2 weeks ago, the Senate Appropriations Committee approved its FY26 Labor, Health, and Human Services bill. And in that bill, there was full funding for all CDC Injury Center programs. So that was level funding at the $761 million. This was a key priority for our whole coalition. It's a huge win, and it is thanks to the hard work that you have all done. So thank you, thank you, thank you, because every call, every email, every meeting, that made a difference. On the House side, you may have heard, or you may recall, that the House Appropriations Committee decided to delay their vote on their bill until after the August recess. So there is still work to be done there, but the victory on the Senate side is really significant. What that means, that was one of our concerns with a Republican-led committee in a Republican-led Senate, is that this would give carte blanche to move forward with a significant reduction to the Injury Center. And what we saw is that the Senate really did take a bipartisan approach, and it did protect the CDC Injury Center's appropriations just as we all intended. So the two chambers still need to reconcile their bills before the end of the fiscal year. This is a win. There's a lot of work left for us to do in that regard to just continue elevating the importance of protecting this work. The other win to celebrate, last week, our coalition did a major media push to pressure OMB into releasing $140 million in FY25 overdose data to action funds, OD2A. This is part of that larger issue that we've talked about a lot with the apportionment coming to the Injury Center and to other CDC centers in drips and drabs. And so they didn't have the funds in their coffers to be able to issue notices of award. With OD2A specifically, they had even at the grantees meeting in July, they had let people know that their plan was to issue partial awards because that was all that they had in their accounts to be able to certify. So that's where that major push came from, because OMB was holding onto those funds. So we did this major media push. We convened a media briefing with partners and national public health experts. Just a few hours later, we began to hear from reporters that they were calling OMB, and OMB was saying, hey, we released the funds. And grantees began to receive correspondence indicating that their funds would be dispersed in the coming weeks. So huge victory for the field, huge victory for the coalition. Again, thank you all for all of your work. You can see up on the screen, there was the reach of this coverage. We know that these funds are really important. And it wasn't just OD2A that was tied up. That just happened to be the biggest grant that gave us a platform to talk about. So our CDC colleagues down to our local partners had expressed serious concern. And now we're really looking at the best case scenario with this resolution. So just yet again, thank you to everyone who wrote, called, emailed, and pushed for this outcome. That said, of course, nothing is simple. With that win came a new challenge. So I'm going to hand it over to Paul to give you the update there and what's going on and what our newest call to action is.
Thanks, Sharon. And again, thank you all for taking the time to join, especially on such short notice. But as Sharon alluded to, we've experienced a handful of wins, and those wins point to the power of grassroots engagement, grassroots mobilization. And so we now, as you see on the screen, we're now facing a situation where the Office of Management and Budget has placed a freeze on these 5 programs that you see on the screen: the ACEs program, the Firearm Violence Prevention Research Program, Youth Violence Prevention, ICRCs, and the Injury Prevention Activities line, which is the line that funds the core state injury prevention program. A few weeks ago, you all may have read reports about an OMB freeze that was placed on NIH, National Institutes of Health, grants. And when that OMB on NIH programs was announced, that freeze was reversed about 24 hours later. And it was reversed that quickly because members of Congress heard from their constituents who rely on NIH funding, and they in turn reached out to officials at the White House and at OMB, and they got that freeze reversed. And so our goal is to replicate that with these 5 CDC Injury Center programs. And yes, some of you may be Core State Injury Prevention Program grantees or ICRC grantees, and you've received a notice of award from the CDC Injury Center. And so so the timing between when some of these ICRCs and Core SIP notices of awards went out and the timing for the OMB freeze on these programs matched fairly closely. So yes, there are a handful of NOAs that have gone out for these 2 programs, but the freeze is still in place. And I should quantify this and note that the freeze we're talking about is a freeze on the spending of fiscal year 2025 funds for these programs. We called this webinar, or organized this webinar, I should say, in fairly short order because timing is critical. Timing is critical because, as I said, we're talking about fiscal year 2025 funds, and the current fiscal year ends at the end of next month. So it's critical that OMB lift its freeze ASAP because the CDC Injury Center needs a number of weeks in order for them to complete all the internal review processes they have to complete before getting these dollars out the door to grantees. So the goal here, the push, is for grassroots advocates to visit our Advocacy Action Center that we have tweaked, we have updated to support this ask. And so I urge you all to visit our Action Center. It's a great way to get the latest information, and the Action Center is set up to make it as easy as possible for you all to contact members of your congressional delegation to urge that they reach out to the White House and to OMB to lift this freeze. Now, we all know that we're in very challenging times. Obviously, advocates are nervous. They're worried about what they can and they can't do. We've been encouraging all of our members, we've been encouraging all those in the injury and violence prevention arena to engage in their own time, to send emails from your personal email accounts while you're back home, either in the evenings or on weekends. And yes, we know that there are still advocates who are worried about engaging on their own personal time. So I would just say many of you also work with coalitions, you work with other stakeholders, local organizations that would most likely welcome the opportunity to engage in the policymaking process. So while we have developed this action center for you all, we've also developed this action center with the hope that many of you will take this and you will share this with the various different networks that you work with in your local communities. So again, the goal today is to send as many messages as possible to Congress urging that they reach out to the White House, they reach out to the Office of Management and Budget to ask that OMB lift their fiscal year 2025 freeze on those 5 injury center programs. So with that, let me stop. I know we wanted to set aside some time for questions and answers. I know we have several folks on the call, so let's open it up for some questions or comments. And if there's anything I glossed over or that you would like additional details on, please let me know.
Thank you, Paul. Just a reminder, everyone, that you can ask questions in the Q&A box, which is at the bottom of your screen. If you can't see it, just hover over the bottom of your screen and it'll pop up as an option. Okay, we have 3 questions so far. Paul, first question's from Amy Patel. What's the date the House side comes back from recess? And would their decision or vote change anything for the September 1st, 2025 grants from the Injury Center, including Essentials for Childhood and CSP?
So the House comes back, I believe it's on Tuesday, September 9th. And so there are 2 parallel things moving at the same time, and that's why this can get a little confusing. As Sharon said, we got a big win on the Senate Appropriations Committee approval of their fiscal year 2026 appropriation bill that funds the CDC. So for fiscal year 2026 today, we're in fairly good shape. The challenge with the OMB restriction is that it places a restriction on fiscal year 2025 funds. So Congress really plays no role in the immediate future on this OMB funding freeze other than being able to place pressure on the White House and OMB to lift that funding freeze. So when Congress comes back in September, it will look to continue to advance its fiscal year 2026 appropriations process, but that is movement that is independent of this OMB freeze that has been placed on fiscal year 2025 funds for the CDC Injury Center, which, as we all know, that fiscal year ends at the end of next month.
Okay, next question. Does the fact that Senate LHHS FY26 propose fully funding all CDC Injury Center programs, including firearm violence prevention and youth violence prevention, mean that the messaging focus of the campaign is now going to shift to include more messaging about gun violence and community violence prevention efforts as well?
So our current message and our push at the moment is for advocates to reach out and meet with members of their congressional delegation while they're home during the August recess to educate them about this freeze that has been placed on by OMB on these injury center programs. And so the message today and the message for the August congressional recess is to urge that lawmakers lift the freeze OMB has placed on fiscal year 2025 funding. When we move into September, yes, our message will shift and we will start working to build support for the Senate appropriations bill that funds the CDC. So as we move into the fall and as the appropriations process advances in Congress, what we will need to do collectively is work to urge that lawmakers understand that we need them to support the funding levels that are included in the fiscal year 2026 Labor, Health, and Human Services and Education Appropriations Bill that the Senate Appropriations Committee approved, which include funding for those lines that you mentioned, gun violence prevention research, as well as the other several programs administered by the Injury Center.
And we've just got a comment in the chat, Paul. I think this is right that the House actually returns on September 2nd instead of the 9th.
I got the wrong Tuesday. Yes, September 2nd. I apologize.
All good. Okay, next question. Will this funding freeze affect or impact various public health organizations from having conferences or symposiums in case those of us in the field need to stay on top of CPEs or the like for maintaining credentials?
The simplest way to address that is to say, if you're a grantee of any of those 5 programs that were on the slide, then your funding is at risk. You're funding everything that you have proposed to do within that program is at risk.
And just coming at that question from a different perspective, Andrea, I couldn't quite tell if you were asking whether it would affect the sort of national organizations from hosting the conferences or symposiums. And that's going to depend organization by organization, how they're funded and who their recipients are. You know, I can say specifically about Safe States, we did opt to go virtual this year because our members are federal grant recipients and they were not able to travel because of the issues with the NOAs and different travel bans. So that does affect the ability to host conferences. Different organizations will handle that differently, and I think things will become more clear in the next couple of months, but happy to talk with you further about that if there's more to that question.
If I could just follow up to a comment that Tom Simon shared in the chat, and that is, for many of these grantees, this is the final year of funding. Fiscal year 2025 is the final year of funding, which represents an incredibly wasteful approach to cutting federal spending, because after 4 years of investments in a program, OMB is now seeking to yank the final year of support when many of these programs will be closing out and will be publishing, will be showing, will be highlighting the results of their work. They will be analyzing and then promoting the results, the impacts of all the work that they have done. So it's an incredibly short-sighted and wasteful approach to reducing federal spending.
Okay, next question. Do we know if the NOAs received for core, SIP, and ICRCs will be impacted by the freeze? Can CDC disperse those funds since they've already been officially awarded?
The short answer is yes. If you have an NOA from CDC, everything that we've heard is that they will honor that they are still authorized to disperse those funds. And that has to do with when things were entered into the system and some of the back end stuff. I think if you have not received an NOA at this point for either of those funding lines, realistically, the expectation is that that NOA is affected by the freeze.
Okay, next question. We received our NOA for core. Does the FY25 freeze mean that we cannot use underspending going forward into the 25-26 performance period?
That's probably something you'll want to talk about with CDC. My expectation would be that if you don't have a notice of award, you're not able to do carryover, because that has to do with you have to have a notice of award in order to spend carryover. If the intention is that the award will be terminated, there's the opportunity for a no-cost extension, but I think the likelihood of that would be low if they're freezing spending on those funds. So talk to CDC about that and get clarity. I can see that going a number of different ways.
Okay, next question. I've already heard from CDC that for some of the frozen funds, even if they were unfrozen, there's not enough time left to get certain funds out the door unless there's a decision high up to extend the external process. This is likely different based on the funding line. What have you heard from the CDC Injury Center about the latest date they can get different monies out the door if the freeze is lifted?
Yeah, that's a good question, because there's sort of the norm and then there's this year. I think there's a couple different things. So just the process is more delayed this year because they're having to get Doge approvals and agency approvals for grants. So everything is just under more scrutiny and it's taking longer. The other part of that is this threat of pocket rescissions, which I think we've all heard about ad nauseum and don't really have a ton of insight into what the process will look like. So CDC hasn't given a specific date. They've shared that those are what the concerns are. Paul, do you have any additional insight on the pocket rescission thing and how that would affect the timing of awards going out?
Well, my only additional comment is that you're right. They haven't given us a date, but what they have said is they will work their darndest to get every dollar out the door if the freeze is lifted. I think one of the challenges they have at CDC, it's really two challenges. One, the timing. With every day that passes, it becomes that much harder for them to complete everything they need to complete internally to get these dollars out. And secondly, they're operating with a skeleton staff. So they've got far fewer staff in place to help them get these dollars out the door. But what they have said is if OMB lifts the freeze, we will do absolutely everything within our power to get the full FY25 funding allotment out to grantees. Now, with regards to funding the pocket rescissions, I don't think the news is good. We've been told that OMB is looking to include injury center programs in a potential pocket rescissions request to Congress. The 45-day window for a pocket rescissions to be submitted to Capitol Hill starts on Sunday. My guess is we likely, if OMB chooses to submit a pocket rescissions request to Congress, they will likely wait until Congress is back in session next month before submitting that pocket rescissions request. And so there's still time for that pocket rescissions request to change. As I said, we have heard that they're eyeing injury center programs, but no final decisions have been made, and we won't really know until we see a copy of that request, if in fact it's submitted to Congress by the end of this fiscal year.
And just quickly, we've already seen GAO opposition. We've seen congressional opposition to the idea of pocket rescissions and already challenging the legality of that. So I think if there is a pocket rescission put forward, it will not be cut and dry. There will be a lot of discussion.
I love this next question. What is a pocket rescission? And I would invite anyone on the line where if we're using any words or acronyms that you're unfamiliar with, please just ask us what they mean. You have the experts here. So Paul or Sharon, what is a pocket rescission?
Yeah, I'm happy to kick us off. It's a request to rescind current fiscal year funds that have not been obligated across various different federal agencies. So OMB is actively looking at FY25 dollars that agencies still have in their accounts that have not been obligated. And so a pocket rescissions request is a request from OMB to the Congress asking that they approve that or that they support the rescinding or the clawback of these dollars that to date have remained unspent in various different federal agency accounts.
Okay, follow-up question for me, Paul. Why would it be that the many smart people on the line who have followed federal funding for many years have perhaps never heard of a pocket rescission? And historically, can you characterize how pocket rescissions have been used at all and legally in the past? Tell us a bit about that.
So pocket rescissions haven't. I think there's only one previous example of a pocket rescissions being submitted to Congress that was not approved. So it's not typical, it's not routine, and it's not typical or routine because traditionally Congress has had the power over the federal purse. So Congress has had the power to appropriate federal funds, which OMB is then charged with dispersing to the various different federal agencies within our federal government. And so, given that traditionally Congress has been the body that has control over the federal purse, the administrative or the executive branch has rarely thought to impede upon Congress's control of the federal purse. A rescissions request is essentially asking that Congress go back and either reverse or change the dollars that they had formally appropriated and approved for whatever federal programs are part of a rescissions request. So that's why it's rare. That's why previous administrations haven't turned to the use of a pocket rescissions request because it impedes on that jurisdiction Congress has over federal spending. Which is why if a pocket rescissions request is ultimately submitted, we're likely to see this battle shift over to the courts, and ultimately the courts will have to decide.
Okay. We can continue to answer a few more questions, although we're almost out of time. So next question is, so if this freeze is in place for those topics/programs, but the funding outlook for FY26 is looking good, is it looking like potentially a year gap in funding for those topics and programs, assuming the freeze isn't overturned? I'm trying to understand how the current outlook is as it stands.
That's absolutely correct, right? If the freeze is not lifted, then there will be a gap in funding for these programs if Congress approves the funding levels that are contained in that Senate Appropriations Bill for fiscal year 2026 that the Senate Appropriations Committee approved. So it's a horrible way to administer federal programs, but the reality is, if this freeze is not lifted by OMB, then fiscal year 2025 spending for those 5 programs will halt. And if there's new funds made available in the fiscal year 2026 appropriations bill, then funding would resume in the fiscal year 26 year once those bills are approved.
Is there a full list of programs that are on the block through this OMB freeze?
That's a great question. I know Tom, I've been following the comments that closely. Tom Simon posted a few resources in the chat that could be helpful. We've been asking the CDC Injury Center for a full list of grantees that are impacted by this, but apparently it's difficult information to gather. So we have the 5 specific programs. And so if you're a grantee of one of those programs, then, or if you work with a grantee of one of those programs, then that funding would be impacting and is at risk.
I'll just add, in addition to the injury center, they're working to gather that same information from the funding lines that were cut at the National Center for Chronic Disease Prevention and the Office of Readiness and Response. So theirs looks a little bit different, but they're working on gathering all this information.
All right, next question. If Congress approves the funding level as the Senate has outlined for FY26, do you think we will be fighting for those dollars next year and going through rescissions and trying to figure out if our programs will be funded next year?
That's such a great question. And I wish I had a different answer for you, but the answer is yes. We're going to face one battle after the next, after the next. And while on the one hand, that may be frustrating, one of the things that we have been communicating to folks we work with is that if there's a silver lining in any of this, is that for the first time ever, this really represents a coordinated approach to educating policymakers about the impacts of injury and violence prevention programs. Up until recently, many members of Congress and many policymakers at the state level either didn't know or didn't understand that they had injury and violence prevention programs working in their communities. So, yes, the answer is yes, we're going to have to continue to fight these battles. But as a result of our fight, more and more policymakers are learning about the positive impacts that injury and violence prevention programs are having in the communities that they represent.
And I'll share, we're hearing this from colleagues in public health outside of injury and violence prevention. You know, they have noted this coordination on the injury side, and a lot of people have been asking about whether there is something more broadly in support of public health that would take on this same type of work. And so they're looking at this coalition and the work that everyone has done as a model for what we could be doing more broadly to protect public health.
Okay, we are over time, so I think we'll leave it there for today. Thank you everyone so much for spending this time with us. If you have questions after we get off the line, you can send me an email and I will route it to the right person. I am at liz@brassrc.com, liz@brassrc.com. Oh, or you can get in touch with Sharon or Paul directly right there. We're going to send you the recording and the links and resources that we shared today, including those from the Action Center that make it really easy and simple for you to get in touch with your member of Congress to make the case for your programs. If you have any questions, you can feel free to reach out, or if you have an idea of how you'd like to mobilize your office, your colleagues, people in your space to reach out to members of Congress and have your voices be heard, get in touch with Paul, and he's ready to brainstorm with you. Thank you, and have a good end of the summer.